An unrelenting medical fraternity threatens to yet again down their tools, determined to have all their demands met about a month since they agreed on a return to work formula with the government.
We had actually agreed that there is going to be a task force that will be formed. And this task force was supposed to conclude its deliberations within 1 week. And then after that 1 week, we were supposed to get into negotiations, because one of the deliverables of the task force was to form a negotiating team between the government and the union. Now, that one was supposed to be done in 1 week, but 6 weeks down the line, the task force report has not yet been released, and this one is just because of a lot of dragging of feet.
The back and forth between the doctors through the Kenya Medical, Pharmacists and Dentists Union and the government birthed from such concerns as paying registrars at Kenyatta National Hospital and Moi Referral Hospital.
And that was supposed to be the first item on the agenda of the task force. To date, the registrars have not been paid.
Then there is the extraneous allowances and emergency call allowances, which were to be effective from December 2011 according to the return to work formula signed on December 12th. The Ministry of Medical Services attributing the delay to the release of funds by Treasury, what has since been looked into according to them.
The emergency call allowance and 50% extraneous allowance for doctors and even all other health workers has been inputted in there, has been factored in their payslip.
They came up with a certain class of doctors, a certain level of doctors that they want to give the allowances, in total contravention of the return to work formula. So that they say we are going to pay these allowances to certain doctors and we are going to leave out others.
Over and above the doctors' pay package were working conditions that include rundown equipment and shortage of staff. Concerns they say the government has continued to turn a blind eye to, and what saw them paralyze healthcare delivery to begin with.
We have come up with a business investment, the document. We have investment plan, and this document talks about how many health workers we may require per year, the number of equipment, the number of theaters we require, the number of renovations we need, and all this has now been actually converted into a cabinet memorandum and has already been taken to the cabinet for discussion.
As the government maintains that it was meeting its end of the bargain, the medical practitioners insist that the government was not half as serious in addressing their concerns as they are. It was expected that the return to work formula reached between the government and the union would generate a long-term solution to the problem of frosty industrial relation, but that may not be so if the union makes good its threat. Mbilu, Citizen, live at 9.